Today I'm going to be doing how to administer care for someone who's externally bleeding. So using direct pressure to control it. This is for emergency care and prevention. This is my gauze for today, my handkerchief. I'm apparently running out of everything. I ran out of gauze. This is my other gauze, my rolling gauze. Has to be a tie today because I ran out of everything. But it is a nice color, I'm sorry. So, first step, you want to have fresh gloves. These are fresh, trust me. My hands are just kind of sweaty, so it'd be annoying to take them off and show you. You want to have fresh gloves, and you want to make sure you have sterile gauze and sterile gauze. You want to cover the wound, wherever the wound is. Let's say the wound, this is my person today, so let's say this is their neck, or alright, neck's a little hard. Let's say this is their arm. If they have a wound there, you put the sterile gauze on. You apply pressure, but you want to try to stop the bleeding. So you don't push too hard so it hurts, but you push enough to the point where you're stopping the bleeding. You hold their arm with your other hand, make sure they're not limp or whatever. And if the blood soaks through the first gauze, you'll then take another piece of gauze, keep your hand here, take another piece of gauze, replace it, put it over, that's it, boom. But if the first gauze doesn't soak through and you stop the blood, then you wanna check for circulation. So in this case, again, my patient's arm or my individual's arm, they have right here, if you feel, I'm sorry, I zoned out. If you feel for the arm next to where the wound is, where they're bleeding from, you want to check to see if it's warm. If it's not warm, if it feels kind of cold and you notice that, let's say their skin complexion is kind of like mine, they're a little more pale, starting to look whitish, so you would know there's no circulation going to that part of the body, because that's just two of the most common symptoms to show that there's no circulation there. So if there is circulation there, then you would feel it be warm. You would notice the colors somewhere near what they're supposed to be, and then you would make sure that that's the only thing happening beyond the injury. To apply the rolling bandage, you would, if it did leak through, you get another one, make sure it's clean, put it on, rolling bandage, hold with one hand. Let's say this is their arm. You hold with one hand, take the bandage, fresh, clean. You start at one end, make sure you're holding the gauze in place with one hand at all times. And then you wrap, you keep going around and around, but you make sure it's not too tight so you're cutting off their circulation too much, and you make sure it's not too loose so it's coming off all the time. But you want to wrap it tight enough so the bandage stays on and the blood obviously stops coming out. But after you do that, you want to make sure that you have something to either keep it there or you know how to tie, because if there's no tape available or anything to keep the rolling gauze on the regular sterile gauze, it's just gonna keep falling. So you gotta tie it around or just improvise. And you would check for circulation again after you put the rolling gauze on. If there's no circulation, you would notice pale skin. You would notice that it feels cold to the touch. It's not as warm. But if there is circulation, then it's warm, there's color. In this case, if there's no circulation, it's when you have to loosen the rolling gauze a little bit. So you untie it or untape it. Try to loosen it if it comes down all the way. It's always better to start over and put fresh sterile things instead of retrying with old dirty ones. So you want to make sure, again, you tight enough so the bleeding stops, but also so you're not cutting off the circulation. After you give them, you make sure they're okay, you stop the bleeding, you give them the gauze, they're all wrapped up. your gloves. Important part. Make sure you don't touch anything, because some people may carry certain conditions, certain, just, I don't want to say diseases, but just different types of conditions that can spread through blood. So you want to make sure that it's clean, and you want to make sure you limit all of the contact with it, I would say. So first, pinch right here. You gently slide your hand out like that. Sorry, it's wet. It's sweaty hands. Then carefully, 2 fingers under your other glove, and you pull and fold until only the outsides are exposed. Until the outsides are inside and the inside is outside. And then you would dispose of your gloves, garbage can, somewhere suitable, and you would wash your hands thoroughly. If the bleeding does not stop with direct pressure, that's when you would call paramedics, 911. If they're ready to go to the hospital, you take them to the hospital, because that could mean just a few things. Could just mean, you never know, they might have a condition they don't even know. I'm pretty sure they would, but if they're hemophiliac, it won't stop the bleeding won't stop the same way, because that's a condition where the platelets don't produce the platelets necessary to clot blood. If the wound is too deep, you'll notice they might need stitches, they might need staples in some instances. It's never a bad idea, if you think the wound is too deep, to go to the emergency room, but definitely gauze, rolling gauze. Try to apply it to the wound, make sure they have circulation, make sure they're okay. And if not, that's when you call 911, or you would go to the hospital. All right, thank you.